New at 4 in today's Community Focus, this week is National Advanced Practice Provider Week. But who are they and what do they do? Joining me now is Dr. Kristen Hubbard from Brown Health. Thanks so much for being here.
Thank you for having me.
So let's try and answer that question. You're a medical director who works with these advanced practice providers, or APPs. Can you tell us exactly what they do?
Yes, of course. So advanced practitioners are our nurse practitioners, our physician assistants, our nurse anesthetists, and our midwives. And so we have our advanced practice providers throughout almost every setting at Brown University Health. And what they really do is help us provide care to our patients. So you'll find our advanced practice providers in, our outpatient settings, our primary care settings, taking care of adults and children. But you'll also find them in our emergency departments. They're working in our cancer institute, in our specialty clinics, cardiovascular institute. And really they're working as part of a team to help take care of the patients, the population of Rhode Island.
Yeah, and we talk often on 12 News about just how hard it is right now to find especially a primary care provider. So how are these APPs helping to bridge that gap for patients?
Yeah, sure. And honestly, that's the biggest benefit of advanced practice providers is that they allow us to improve access and improve access to health care, because it's a challenge. It's a challenge everywhere. I mean, we all know that there is a lack of providers, and there's a need and there's a demand out there. So advanced practice providers help us fill that need. And they actually do it in a lot of different ways and actually in a lot of different settings. So I'm a primary care physician, so I work with my APPs and APPs across the organization. And in primary care, a lot of our physician assistants and nurse practitioners, they actually carry their own patient panel.
Oh, wow.
So they serve as the primary care clinician for thousands of patients across the organization, which is wonderful. And then in specialty care, they are working with specialists to see patients that maybe they aren't, able to see in a timely manner. You might see your cardiologist, for example, and your cardiologist says, hey, you're not doing so well, let's change some medications, but I want to see you really quickly after I change these medications. And might not be able to get you in, but his physician assistant can, and she can take over and check in on you and make sure you're doing okay and make sure those changes are working. And so it helps us take care of our community and fill those gaps when the physician might not be able to. And I could go on forever.
They're playing a critical role. And I just want to ask you quickly, because we're running out of time, you have a mentorship program for them. Why was that so important to you?
The mentorship program was so important to me because when advanced practice providers join primary care Brown Health, they're joining a team. We work as a team, we take care of patients together as a team, and we want to support them and mentor them and teach them how to work within their team. And so if you have a complex patient who's sick, we want to say to them, I know you know the medical piece, but let's make sure you know who to reach out to get help with the pharmacy piece and the medication piece. Does this patient need help at home? Who's your nurse care manager that can help you take care of the patient? So it was important because anybody knew there's challenges and obstacles, and we wanted to support them and help them overcome those obstacles and challenges so that those APPs can just take care of the patient in front of them and do what they do best.
Unfortunately, we're out of time, but Dr. Kristen Hubbard, thanks so much for being here and filling us in.
Thank you for having me. I appreciate it.